Hello, in this video I am going to provide a very high-level overview of the research project that you're going to be working on this quarter. By the time you're getting to this video, hopefully you've already watched the course introduction video. If you haven't done so already, please make sure to go back to Canvas and watch that video first. After you've watched that introduction video, you hopefully are then watching this video that provides an overview of the research project this quarter. In this video, I'm going to provide just some very high level information on what exactly you're going to be working on this quarter. So before we get into the actual research project, I do want to provide some very high level guidance and information. In next week's module, I'm going to post some more detailed information to give you a lot more detail on the topics and information that I'm covering in this video. So if you feel like all of this is really high level, that's because it is. We'll get into some of the more detailed information that will help you understand the concepts in more detail. We'll get into that next week. So I want to start off by talking briefly about the Affordable Care Act, or as we refer to it, the ACA. It was signed into law by President Obama on March 23rd, 2010. We often hear about the ACA referred to as Obamacare as well. The ACA and Obamacare, those are the same exact things. They just have different terms that people refer to them by. Before the ACA, a lot of people didn't have health insurance for a number of reasons. Maybe they couldn't afford health insurance. Maybe they were denied health insurance because they had a pre-existing condition. And even if you had health insurance companies excluded a lot of different services from coverage. So there were all these issues that existed within the US healthcare system. And the ACA came in to try and address at least some of those issues. It hasn't addressed every single one of those issues, and we still have challenges within our US healthcare system. But by far, this is really the biggest kind of landmark piece of legislation that has been passed around healthcare, certainly in our lifetime, and in terms of recent years. We really haven't seen anything like the ACA until 2010. So the ACA had three major goals. The first goal was to make affordable health insurance available to more people. Another goal was to expand the Medicaid program. For those of you who don't know, Medicaid is a really wonderful and very important program that provides health insurance to individuals who meet income thresholds. So if you are an individual who earns less than a certain amount of money, then depending on what state you live in, you might qualify for Medicaid health insurance. It's a really important health insurance program that provides health coverage and health insurance to individuals who might not have that insurance through, for example, an employer, and they might not be able to afford purchasing that. So it is a free state-run health insurance program that's run at the state level. And the third goal was to support innovative medical care delivery methods designed to lower the cost of healthcare generally. So one of the things that we finally saw with the ACA is this requirement that a lot of these preventive services had to be covered by health insurers, and they had to be covered without any kind of cost sharing or anything like that. So a lot of cancer screening was now provided to people with no copays or anything like that. It was covered at 100% to make sure that people had access to these preventive services, which in general typically can lower healthcare costs. Now, one of the really important pieces of the ACA, beyond the expansion of health insurance and some of those other things I briefly mentioned, was that it required that most insurance companies had to provide tobacco cessation interventions or cover tobacco cessation interventions for those who use tobacco products. So in a nutshell, insurers have to cover tobacco cessation treatments for individuals who smoke or use tobacco if those individuals want to try to quit smoking. Those medications are covered at no cost. And the way that you, as an individual who uses a tobacco product, the way that you get those quit medications is you have to get a prescription from your healthcare provider and then go fill that prescription at a pharmacy. So just as you would kind of any other prescription medication that's covered by your insurance, if you want to quit smoking, you need to talk to your healthcare provider about that. They need to give you a prescription. You would then take that prescription to the pharmacy, and then your insurance should be covering that quit medication without any cost sharing. So you shouldn't have to pay any kind of copay or anything like that at the pharmacy when you pick up that medication. Next week, we'll talk a little bit in some more detail about what that coverage looks like, but in general, just know that insurers are supposed to be covering quit medications for individuals who use tobacco products who want to quit smoking. In terms of the evidence that's out there on the effect of this policy on tobacco cessation, we do know that there's some evidence that the Affordable Care Act has led to increased quit attempts and improvements in tobacco cessation in general. Most studies have examined the effect of health insurance on cessation, and a lot of these studies have primarily focused on Medicaid expansion, meaning that they've looked at states that increase the eligibility criteria for health insurance through those state Medicaid programs. So some states have basically said you had to make a certain amount of money to qualify for Medicaid. Some of those states, because of the ACA, decided to expand that eligibility, and so those income levels, those increase. So people who didn't qualify before because maybe they made too much money, those people now under the ACA, if they made with whatever the state said was the new amount that they could make to qualify for Medicaid, those people then got Medicaid health insurance. So most studies have really examined kind of the effect of actually getting health insurance and how that has affected quit outcomes and quit attempts among individuals who use tobacco products. So health insurance, we know, is a really important piece of understanding factors that contribute to increased quit attempts. But other than health insurance, I'm interested in understanding, are there other factors that increase quit attempts? Understanding the mechanisms that affect quit attempts are really important for supporting and promoting cessation among individuals who use tobacco products. So in the post-ACA landscape, after all of this policy has been passed and put in place, what we see is that essentially insured individuals should have coverage for tobacco cessation treatments. That level of coverage might differ a bit depending on what type of insurance they have, but for the most part today, people with health insurance should have some level of coverage for tobacco cessation treatments. And we know that they can get those tobacco cessation treatments, specifically quit medications. They can get those covered by their insurance with a prescription from a healthcare provider that is then filled at a pharmacy. So this leads me to our current study that we're going to be working on this quarter. Our research question is examining, are access to care-related factors associated with quit attempts after the passage of the ACA? So what specifically do I mean? How am I operationalizing those two items that we're looking at in terms of that association? Well, these are our main variables that we're going to look at in our study. So our independent variables or our exposure variables, we're going to be looking at two questions. So the first one is understanding whether someone has a doctor that they think of as their healthcare provider. So does that person have some sort of identified doctor that's their healthcare provider that they think of as essentially their source of care? The second variable we're going to look at as the independent variable is how long has it been since they last went to that doctor for a routine checkup. And then our dependent variable or outcome variable that we're looking at is a quit attempt. So essentially whether or not someone tried to quit smoking in the last 12 months. So have you stopped smoking for 1 day or longer because you were trying to quit in the past 12 months? So we're basically trying to see, are these two variables here, are they associated with this outcome variable here? Now, given what we know about tobacco cessation coverage, needing a prescription from a healthcare provider, filling it at a pharmacy, and being able to get that medication to quit smoking at no cost, I would hypothesize that people who have a person or a group of doctors that they think of as their personal healthcare provider, those people are going to be more likely to report trying to quit smoking in the last 12 months. I would also hypothesize, in terms of this second variable here, that individuals who have seen their healthcare provider more recently, they are more likely to have quit attempts, to have tried to quit smoking, versus people who might have longer periods in which it's been since they last went to that doctor for a checkup. So where are we getting this data from for this study? As I mentioned in the introduction slide, we are going to be doing a secondary data analysis. So what this means is we're taking data that has already been collected, that already exists, and we're taking that data and we're going to analyze that data. We are not doing primary data collection where we're collecting data ourselves. We're looking at an existing data set. And the data set that we are using is the Center for Disease Control and Prevention's, or the CDC's Behavioral Risk Factor Surveillance System. You'll often hear this referred to as BRFIS. That's the abbreviation for this data. But it's national data that's representative of adults who live in all 50 states. Next week, you'll learn a little bit more about the actual BRFIS system data, and so you'll understand kind of how that's collected and what that looks like. Our sample will be US adults, and we're going to be looking at around 200,000 individuals that will be included in our sample. And the time frame that we're going to be looking at is between 2015 to 2018. You'll see why next week, why 2015 makes sense in terms of where we're starting. There was some guidance issued in 2014 on what insurers were supposed to cover in terms of tobacco cessation coverage. So we didn't want to include that period kind of before that because the coverage may have differed. So we're starting with 2015 to make sure that in theory, everyone with insurance should have a more similar kind of uniform coverage for tobacco cessation. And then we're looking at data through 2018. And the reason that I'm not looking beyond 2018 is, as you all know, in 2019, we had COVID, and COVID has done some weird stuff in terms of access to care as well as smoking. And so I don't want to have any influence from COVID in our data. So I'm just going to look at this time period from 2015 to 2018. So what is the work that we're going to be doing this quarter on this project? We're definitely going to be writing the introduction, and all of you are going to be working on that. I might also need some help with the methods section as well as other sections, but definitely the introduction, and we'll see if there's other sections that you all can contribute to. We will need to analyze the data. I did spend the break kind of cleaning the data, so the data should actually all be set up ready for our analysis, but we'll need to actually analyze that data this quarter. Every manuscript has tables in those manuscripts, and so you all are going to help me with creating those tables. We'll also need to identify a journal in which we're going to submit this study for publication, and then hopefully, if we have time, again, I'm not sure if we will, but if we do have time, hopefully we'll be able to submit our study for publication in a journal. I hope that since there's multiple people in this senior research project this quarter, I'm hoping that you'll all work together as a research team on this research project. Now you'll have to submit some of the required documents individually for your senior project requirements. But in general, I hope that you'll all work together. It makes things a lot easier when you're working together as a research team. If you have any questions, let me know. Otherwise, next week, we will plan on diving into a more detailed explanation of some of the topics that we covered earlier on in this brief presentation.